Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Welcome back to DigitalMD, the podcast where we talk to leaders in the digital health ecosystem about innovation, decision making, and how we think. I'm your host, Dr. Liz Kuo, and today I'm thrilled to have Elizabeth Montgomery with us. She's the National Vice President of Clinical Practice and Innovation in Population Health Programs at the National Kidney Foundation. So Elizabeth has 25 plus years of experience in management consulting, specializing in strategy, change management, and her career began as a business unit manager of an organization that conducted electrocardiograms on animals over the phone, cardio, which is pretty incredible to start. And then her career took into moving from that into marketing and services for a company called Medical Data Management to leadership of the different kind of biomedical business units for another electronic medical system. I love all these different words, so I'm stumbling over them. But over the course of this, she led the development of a lot of innovative programs, even at a 501c3, focusing on improving care for movement disorders. So going through all of this work as a consultant, as a corporate performance consultant, in addition to leading a variety of programs, she then joined the National Kidney Foundation in 2014. So currently she leads a huge initiative, she'll talk about it, which has been 10 years in planning. She joined the foundation in 2014 to work on the development of CKD Intercept. It's a strategy to improve chronic kidney disease testing and management, basically in the primary care setting, where as many as 90% of people with CKD currently remain undiagnosed. So as the National VP of Clinical Practice and Innovation and Population Health, she's responsible for the design, the implementation across all the targeted ways to improve CKD. So Elizabeth, thanks for being here.
Thanks so much for having me.
Before we dive in, is there anything you want to add to what drives you and how you ended up in where you are today? Can you tell a bit about your career moves and why you made them?
Sure. So what drives me, I was thinking about this question, trying to really kind of dig into what the foundational motivation for how I've approached my career and the work that I've driven. And it all has to do with understanding the collective we. So 100 million years ago, I was working with medical data management, and a colleague had started a business in the former Soviet Union. And so I was relatively young, and I was traveling to what, essentially were third world countries in the early 1990s after the fall of communism to try to help build a business there, to bring Western thinking, problem-solving business practices into a formal demand economy. And I literally would come home from these trips, get off the plane in JFK and want to kiss the tarmac because the just perceptions, quality of life, access were so wildly different than anything I had experienced in the United States. And it helped me develop, a firm appreciation of all these flights back and forth with, other people who were going to the former Soviet Union to be of service to try to help rebuild after the vestiges of communism. I really began to understand and really appreciate how fragile the whole system is.
Yes.
And how interconnected we all are. And how if we don't stay focused on that bigger collective we, if we lose sight of how all these pieces fit together, no one of us is going to lose, all of us are going to lose. And so that vision of, how we solve problems collectively, how we work together in order to resolve the issues and challenges that we find in front of us has been like an underlying I don't want to say passion, but the foundation, the drive. How do we bring everybody together to work together in a smart way so that everybody wins at the end of the day? And so
Yes.
that's how I would answer that first question.
Would
In
you
terms,
recommend, just to unpack that a bit more, people to understand more cultures, get more experiences, travel abroad to do the things that you've done?
oh, 1,000%. I never had such a strong appreciation for how ugly an American I was until I would go overseas. And by the end of the first day, my manicure would be destroyed.
Sure.
Because in the United States, there are consistent fire codes across every state so that when you go into a building, the door opens one way. When you leave a building, the door opens another way. Not so in other parts of the world. And I would literally, the first day I'd be on the ground, I'd be laughing at myself because I'd be walking into doors and breaking my nails, expecting things to go the way that I thought they would. And when you think about how granular and really silly that is, as just a reflection of how much of variation can exist in your normal perceptions and how you engage with the world and
Yes.
how you act on the subway. My first ride on the Russian metro, the person I was traveling with kept elbowing me like, stop. I'm a New Yorker. I'm looking around. I'm watching people. Everybody else is looking at their feet. And
Mm,
she was like, stop for, drawing attention to us. And I was, well, what am I doing? I'm being someone from New York in a place where my reality was very different than theirs. And so
yes.
if you can travel, if you can truly, I didn't stay in Western hotels. We were a startup. So I was staying in somebody's rented flat before Airbnb was a thing. And I'm not lying to you when I say that there were mornings I woke up and there were visitors on the pillow next to me that,
Oh,
were just not well because of the nature of the environment. And
yes.
it truly built an appreciation for how privileged we are here. But again, this understanding that if we don't balance the dynamic and we don't pay attention to
Mhm.
what's going on in the larger ecosystem around us, that privilege is going to erode. And so
So,
that sense of how we have to work together to make sure everyone rises is really just kind of part of my DNA.
so just to understand a bit more too, as you delve into your organization, change management, because you're thinking about how to change the world and how to incorporate what you've learned into how you lead and all of that. What are your key factors to success? How do you think about what leads you to this, 10-year strategy as you've incorporated all these experiences into your career?
So the first thing I would say, and it's really kind of funny because I'm on a podcast talking about me, is that it's not about me. That I learned, there was this famous, I don't know whether it was a philosophy of language example that I used to use all the time regarding this idea of Wittgenstein's broom. And Wittgenstein was a philosopher that when it was thinking about just the substance of things. And he postulated that, no matter who you are, you're going to walk in a room, you're going to see a broom. And you're going to have someone's going to say a sentence to you like the broom is in the corner. And every single person in the room will have a different interpretation of what that means
Mm,
because that's driven by their socioeconomic, cultural, temporal surround, right? So that type of the broom, the color of the walls, the type of the floor, the angle, whether there's sunlight, that's all going to be interpretation on someone else's experience in their journey. So when you're thinking about leadership and you're thinking about, okay, I'm an American going to a former demand economy to try to help build a business there, I can't be coming with a New Yorker's definition of what that broom in the corner is. So I really need to understand if I want to drive change anywhere, I really need to understand what the foundation of that current state is culturally and with perspectives and perceptions, the whole 9 yards, before I come in and start offering any pathway for change. Because if I'm not sensitive to the existing system, which is,
yes,
people are the system, I'm not going to be able to change anything within the system because the
that's
system
right.
is going to resist that. So having that sensitivity, being able to listen creatively, taking off what you think you know. I thought doors opened a certain way in New York, right? And really digging into what is happening here for somebody else's reality has been the kind of the cornerstone of the success of the change that I've led.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at home testing for health plans. Their convenient, member centric approach has helped plans achieve industry leading results. In just 1 year, Everly Health Solutions helped a multi state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.
That's wonderful. I do think that a lot of the leadership style you're referring to is somewhat of a servant leader, but also of understanding what you need to do to make impact. But it's the collective we, it's the collective understanding and knowing where you are and also being in a position of power to be able to make the changes that you want to see. And how do you rise to there? We're doing something a little different today, as we talked about, which is there are three key books that you and I have both grazed upon and learned about. And so, speaking of your leadership style and how you manage that, I've recently read this book about by Sydney Finkelstein. It's a book on just different kinds of leadership styles, and it's called Super Boss. So there are three different types, which is first the iconoclast, the next is the nurturer, and then there's also something called the inglorious bastard. So iconoclasts tend to be those that are able to inspire without intending to. Miles Davis was one. He inspired young musicians and was known as a great teacher. Inglorious Bastards, don't love that name, but it is characterized by the strive to win. Do whatever it takes, get top-notch team to support, and failure is not an option. I think the Oracle founder, Larry Ellison, is well known for that. And then there's also this third cadence of nurturers. Those are people that tend to want to see employees grow. They're always ready to guide the team members, ensuring they thrive. And the Star Restaurant owner, Norman Brinker, was known for his nurturing management style. So out of these three, how would you characterize your own leadership style?
So my answer to that would be I align with Peter Senga's vision of a servant leader, right? That this vision of it's not about me. It's about how do we all get to the end game in the most effective way possible. So when I looked at that, I chuckled because I don't necessarily feel I fit into any one category every day. I mean, I kind of modulate my management style on the basis of the team or the challenge that I'm working on. So from this idea of being the iconoclast, I'm only as good as the team that I recruit, right? So I need to ensure that that I find people to whom I can give the ball and tell them to go, because that for me is the kind of leadership that I had when I was, starting on this journey of, oh yeah, let's go to the former Soviet Union and start a business. How do you
Yes.
do that? Right? You take the ball and you run one conversation at a time. So I like to nurture that in the people that I work with and around, supporting their growth as effectively as I can. Would definitely say I'm not so much the inglorious bastard or the day that I have to be that. I think the one thing that my team knows about me is that I'm not going to ask them to work harder than I'm already working. And I'm not going to ask them to do anything that I'm not with them doing. So if we have a grant proposal or some sort of deliverable, that means it's a 24-hour day. I'm in that 24-hour day with the team to demonstrate that this is what we need to do to get the ball down the field, but it's not something I'm going to demand that they do by themselves. And then I'm sorry, what we want to comment?
Well, speaking of teams, I would love to us to understand, we should touch on some point, how you're able to create a 10-year strategy, get the loyalty, get people to be driven, and be able to follow through on what you've done at National Kidney Foundation, because that's not easy to do.
Well, it's not easy to do anywhere until you're vested and your team realizes that you are creating opportunity for them. That, at the National Kidney Foundation right now, I have largely the privilege of working with a relatively young team on the CKD Intercept work that we do. And this is a tremendous opportunity for someone who is not too far out of school, with a master's degree, to really dig into transformational work and to be able to create the environment where, all right, here's the guardrails. You figure out how we're gonna move from point A to point P within these guardrails. That's amazing stuff that you can put on your resume that you wouldn't necessarily have from a job where you are highly structured and highly scripted in terms of what you have to do. That builds loyalty. That absolutely builds loyalty. And it builds an organization of people who are really vested in making it work, because it's not only the organization it's winning, it's their expertise over time that's being developed as a result of it.
Now, what do you see now is the fruition of your labor? I would love to hear some of the things that you're already seeing after 10 years of planning, because 2014 to now, it's pretty exciting.
Yeah. So we're now, I just did a map the other day. We are operating, in the last 3 years, the work that we've been doing has gone from 3 states to almost 20 states. And we have 70 large organizations working with us in some capacity to look at what needs to change around the quality of chronic kidney disease care that exists in their institution. And so we've gone from 3 FQHCs in our initial program in Virginia to this broad reach where we can now say that we've got 9 million lives at risk for CKD and 1.2 million people living with CKD being directly impacted by our programs in 2.5 years. And when I say direct impact, I mean going from having 20, in a large integrated health system where you have over 100,000 people at risk for kidney disease, going from 20% of people being tested to 70% of people being tested in 10 months, or increasing the rate of diagnosis of chronic kidney disease among the diabetes population in that institution, going from 20% to 73% of that population in 10 months. That's dramatic. And it's impactful because, we know at the end of the day, thousands of lives changed because we put the time in to drive the strategy to help the system recognize there was a problem and then move their way through making the systems level changes that need to happen to not only ensure that someone's getting tested this year, but they're going to get tested and diagnosed in perpetuity because the system changed around the clinicians that are providing care.
And it's them early enough to make a difference, in
100%.
addition to have an intervention that educates them, because not all people are educated. Most people aren't. As you said, 90% are underdiagnosed. And so having the not only awareness, the education, but then the interventions that you're saying to connect them to the right resources, that's pretty incredible. In healthcare, it's not always possible. Sometimes there are the genetic markers that don't tell you much. It doesn't change your intervention. But I always talk about in digital health, you want something that, if you diagnose, can change management and can prevent further progression of the disease.
Yeah, and you're looking at the new interventions that are available now, a 30% reduction in the progression of CKD, as well as the associated cardiovascular risk, which means that people now with kidney disease have an opportunity to die with kidney disease instead of kidney disease. And when you think about what that means in terms of longevity, it is significant, the impact that you can have. So and I didn't mention that the use of the novel interventions in management of kidney disease increased 5-fold in that 10-month period around the intervention. So we know that we're not just getting people diagnosed. We know that their care is changing because of the strategies that we've deployed to drive large-scale change around kidney disease.
So I would love to understand your definition and goals for not only kidney disease, but also population health and strategies to employ um, and how to address different populations, especially in the community. Because, and then at some point, I'd love to talk about, you and I mentioned this concept of outlive by Peter Attia, a physician, but also Bill Gifford. They talk about this idea of how do you incorporate behavioral changes from exercise to fitness to sleep, importance of nutrition, and all of these things that are contributing to emotional well-being.
All right,
So
so
I
let me
guess
address those two
yes.
questions. Okay, so I smiled when you raised the question of population health because I just was speaking at a conference last month and I'm a little bit of a renegade.
Mm,
So this was a population health conference and I, started the dialogue by saying that, my definition of population health is a healthy population, which takes it out of this conversation of the pharmaco-medico model of, well, it's just within healthcare, and really, raises this to this discussion of what do we need to do to prevent disease? What do we need to invest in to ensure that we have a population, our citizens, our colleagues, our neighbors that fully understands they're fully health literate to the best of our ability, and that they understand that they have the choices and have everything behind the choices that makes it possible for them to thrive. Because one of the things that makes me crazy is when I hear, in healthcare, there's non-compliance, and I see non-compliance as people without good choices making the best
mm,
choice that they can, right? So my definition of population health rises from this traditional, I'm just going to manage chronic disease, or into, is there a better way to prevent chronic disease, and this discussion of health related social needs into this conversation of how do we build society? How do we invest in our communities in such a way that people are receiving the education that they need, that then would allow them to make different choices later on? How do we ensure that they have all of the access that they need in order to be able to achieve, what the vision is in this idea of outlive? How do
yes.
we create that environment that we support the psychosocial needs that arise that undermine individuals' ability to make better choices? I look at the obesity epidemic and I see that as a manifestation of addiction. That you
Mm,
have, 30, 35, 40% of the population now that are obese, another 30% are overweight, and they aren't capable of changing their behavior. There's an underlying psychosocial dynamic there that we need to address if we're going to get ourselves out of this discussion. So really putting on that different lens to look at population health less as strictly this conversation of health care, and into a broader discussion of how are we going to reinvent how we look at the psychosocial universe around us to ensure that basic needs are being addressed so that we all have the opportunity to thrive and to achieve that long-term vision.
I appreciate that a lot. I think especially as you talk about imagine if you can create a world around it, and it's the holistic approach to it. But some people don't always have the luxury of being able to sleep 8 hours, or being able to break the standard American diet, the SAD, which is a lot of sugar or processed foods. But how do we make it easier potentially to provide for discounts on nutritional items, or being able to have a workout or the ability to work out with time and things that are making it easier, even with emotional well-being? Is that something that you would also focus on, especially in population health holistically?
So you're talking to someone who has not ingested sugar since 1997, right?
Oh my
I don't
goodness.
drink. Don't eat sugar. I don't consume caffeine. So yes, I absolutely believe that there is investment we need to make in order to help people understand that their behavioral choices are bigger than their behavioral choices. And this kind of comes back to this discussion of leadership, right? That the same people that may be struggling with their weight are in your employee population. They may not be engaged in a degree of complete awareness around what their motivation is for some of their choices. And you're going to see that play out in your team. So recognizing that there is this bigger behavioral discussion and seeing how it not just impacts the overarching health of the community around you, but the health of your team is really critical to being successful. And there's work by a gentleman named Robert Keegan, who is,
Yes.
you're familiar with him, on immunity to change and the evolution of the psyche, that the
Absolutely.
process is the process, and that we need to consider that evolution of that basic decision making in all the work we do, whether we're looking to change the health of communities or whether we're looking to motivate our people.
I love that. I would say also, if there's a way to gamify it, especially I like this concept of Outlive because they said, imagine being able to perform 10 physical tasks when you're 100 years old, climbing stairs, hiking a trail. It's almost like a centurion decathlon. And being able to think about the changes that lead to that behavioral modification to lead to, let's say, fitness goals, walking briskly. They talk about zone 2 workouts, but also things like we undervalue sleep. And it's something that I've started to really focus on, being able to create sleep hygiene in a way that makes sense. And then on top of that, thinking about the longevity mindset, it's just as important physical health. There's emotional well-being and surrounding yourself with friends and people that you trust. I think Americans also oftentimes are overworked and don't focus so much on the community aspect. And so you must be doing a lot of that on population health side too. It's the people that you surround yourself with to foster that type of health focus.
Percent that, I have the blessing of having a network of like-minded individuals around me that provide the support for the resilience, the people that I know that I can turn to and call and acknowledge that I'm human like everybody else. There's a problem that's bigger than me. I don't have a solution here. I just want to run somebody over with the truck someday, to kind of walk your way through what that emotional response is, right? Because at the end of the day, and I was thinking about this a lot as we were, talking back and forth about this podcast, is that, my definition of success is self-mastery. My definition of success is being able to build a life where I have the resources, the community, the mentors, the teachers, the Sherpas who will help me understand how I can more successfully manage my internal emotional state. So this is the emotional intelligence conversation, or Robert Keegan's work on the self-transforming mind, right? That I get to look at myself every single day and be able to, without shame, blame, or remorse, say, well, here's something you need to change. Here's something else you can do to be better. But to your point earlier, there's a large cohort of our, fellow citizens who don't have those networks, that don't have those resources, that are in a place where they've had the foundation of success enough in their life to recognize that you can fail up, and that there's opportunities that arise when things don't go the way that you want them to, or they've been discriminated against their entire lives. So you really think they're going to go out there and take a risk to do something differently? So when we think about, all of these pieces and how we bring them together, going back to this investment, I would love to say to someone who's living in the most challenging zip code of any state, here's the book, Outlive, go there. But recognizing that there's a whole level of change and support and emotional mastery that's involved in somebody being able to say, this is the life that I want for myself 10, 20, 30, 40 years from now, and have this sense of confidence that they're going to be able to achieve it. And so building that framework is what sits back behind all of the chronic disease issues that we see, because they are all driven by social determinants and behavioral choices and all of those things that work together. And until we find a way to actually focus on that socially and within our teams, we're going to continue to get the same kind of outcomes that we see.
You're absolutely right. I think this reminds me also of, when I, as a physician, when you're working in the clinical setting, there's so many things you wish you could change for the person that you're trying to address. And it's a holistic approach that not every physician has time for. You don't always have a full hour to talk to them about all the things they should address. But one thing I have found is useful is an approach that I have with my patients. And you and I have talked about this, which is this book by Pema Chaldron, When Things Fall Apart, and that change is the only thing that's consistent. So the goal is to focus on how you navigate life's challenges with grace and self-awareness. You said, you focus on yourself. And this idea of embracing fear, I think being aware of what death is and sort of thinking about sometimes your own obituary, what you would write, but also thinking about how to not just avoid fear, but confront it, reflect on it, thinking about loneliness as a way to self-discover rather than feeling solitude. Like you said, it's building your own board of advisors. I do that with my own friends. Friends that help with XYZ type of career questions, but also thinking about how we can navigate anxiety and dissatisfaction, whether it's in life or other things. And then lastly, we talk about compassion and impermanence for yourself, and thinking about this life and how it's constantly in flux. We are able to embrace change if we're able to know that it's okay to know that things will change and practice this idea of egolessness. It sounds like you're also very in tune with that concept.
I laugh, Liz, because when you make reference to the idea of the experiencing the groundlessness, this acceptance of impermanence and change, a couple of things go through my mind. The first is I have 2 adult children at this point, and they're rolling their eyes if they could hear this conversation right now, because they must have heard this from their mother 1,000 times. This is spiritual sandpaper. What you're experiencing now and you're looking at as the end of the world, the most difficult thing you've ever encountered, you're never going to survive this. This is where growth happens. Growth doesn't happen when, walking's easy when the road is flat. That's not where we grow. We grow when the universe, life, whatever you say, says, you know what? You had a plan to be over here, and my plan was different. And we have to learn to adapt. So I used to send my kids songs. I'm a musician. And one of them is I Wish You Pain by Andy Grammer, right? Mm-hmm. Those painful moments, those moments when you're not getting what you want, is when you really have the opportunity to dig in and determine who you really want to be. Yes. And how you really want to navigate the world. Because at the end of the day, as I mentioned earlier, success is self-mastery. When we end our lives at some point, because it's going to happen to both of us, what we achieved is not going to mean anything. What we've done to help others and the good that we've left behind and the work that we've done to lift other people up on this journey of self-awareness and success, that is going to outlive us both.
I agree.
And so recognizing that this is there, there's no room for judgment. What is it? Ralph Waldo Emerson said that, life is the rapid efflux of good reorganizing itself. Finding that opportunity for growth, no matter what the groundlessness looks like, and then living into this is part of the experience. The second song that I used to send them, really hokey, but so effective, was a song from Chitty Chitty Bang Bang, The Roses of Success. Disaster didn't stymie Louis Pasteur. Emerson took years to see the light. It's all true. And if we could get more people to have that growth mindset, to have that understanding that life is about the lemons and how you translate it into lemonade, then I think we'd be in a very different place.
So it sounds like they're going to have to listen to this episode because they're just going to love it.
Some good reminders.
But the follow on is, I definitely think this idea of groundlessness and thinking about honor and what you want to leave behind. Honor has been my New Year's word. I have a word every year. You and I have talked about last year for me was deliberateness and intention on things that I spend time on. So I couldn't agree more. And the goal I think for us is to actually there's a bit of a balance. It's a dichotomy between thinking about the future, how you're planning your 10-year or 20-year goals, but also living in the moment and being present. So I think there's some enjoyment of thinking about both. And I just really, I think, embrace this idea of discomfort because it does help you learn and grow. So listeners, these are questions that we have explored throughout this entire process. And as we aim to delve deeper into Elizabeth's professional journey, I think I have some hot takes, which we call sort of some ending questions to provide listeners with these insights. So it's been an absolute pleasure, Elizabeth. Thank you for going through this whole journey with me. And today, before we wrap up, we always ask our guests for the best advice you want to give.
My best advice is get over yourself. Make a decision to live an examined life. Take a look at what is emotionally and behaviorally holding you back. Be as rigorously honest with yourself as you possibly can, because it's only through that rigorous honesty of what's not working in your professional, personal life at this moment right now, that truth is what's going to liberate you. So no matter what's happening around you, develop a practice of asking yourself, how did I respond? What could I do better? And what would I have to change in myself to really be the person that I want to bring into this type of situation next time? And you will watch your life and your career change dramatically.
Wonderful. How about the hardest challenge and how did you overcome it?
Professional or just life-wise?
Let's do life.
All right. So I am the product of an alcoholic household. Both of my parents were very, very sick people. My father was an incredibly successful business executive, and there is a lot of baggage that comes from living in an environment where there is no safety. I have survived every type of trauma that a child can survive.
Very sorry.
And so it is a challenging place to start. However, learning everything that I put forth in this conversation of really learning how to step back, having networks of people around you who can help you unwind what you can't see about yourself, and then working to build adaptive skills that you may not have modeled for you, regardless of the type of trauma that you might have experienced in your childhood, is the foundation for success over time. And so I, am happy to say that, my life reflects the commitment of accepting that this was where my life started, and the decision that I made at some point to not be like them and to have different outcomes, which I can gratefully say that I have achieved.
I appreciate you sharing and also sharing the ability for you not to anchor and caveat and think about, I'm this way because of this and being able to step out of that. I think that's incredibly courageous. So thank you.
Well, one of the things I've learned from the journey, Liz, is that when you make the decision to be a survivor and you invest in helping other people survive, what you have gone through then becomes the greatest gift you've ever received. Because you now have the keys to the kingdom. You have the ability to help other people who are starting in that same very difficult place to see a path, see what is possible, and have an opportunity to actually make an investment for them to get the same sort of outcomes, which then brings meaning to everything that happens.
Absolutely. Well, with that, I have two other questions and then we can wrap up, but I absolutely appreciate that candor. And I like that that's very empowering. It's the keys to the castle to unlock because there is a lack of fear or worry about what you'll end up because there's only one way to go up.
That's exactly correct. And I've seen seen and experienced things that I wouldn't wish on other people. So what can scare me now?
Mhm. What is your what do you think is the most exciting right now about healthcare innovation? I feel like this is a healthcare podcast, so I want to end with that. And then lastly, your superpower that you'd want to have.
Okay. So I again chuckled at your question because all of the innovation that we've done and all the discussion of AI and all the digital tools that we have underscored very clearly in the last couple of years that it's non-digital things that are going to make a difference in the success of healthcare, and that's trust and safety. That unless we are in a place where we have the capacity to connect with others in a clinical environment, in a very authentic, very meaningful way, all those digital tools are not going to matter. And I think the revolution that we've been driving around having all of these pieces has illuminated again and again and again the importance of ensuring that we have the soft skills that go along with it. And there's a conversation now in healthcare about how we rebuild those soft skills, how we rethink care delivery to ensure that we're building that trust and safety. And I think that is the most amazing innovation that I've seen in the last 20 years, because that is what's going to bring us back to the ability to connect with those individuals that need that sense of connection in order to be able to make different choices in their lives.
Great. And what about your superpower that you would want to have?
My superpower would be the Vulcan mind melt. I would be so happy if I could just like put my hand on your forehead, understand your entire journey, all of the perspectives, all of the things that your strengths, the areas that could use work, so that when I have a conversation with you about whatever we're discussing, we could literally meet where we needed to be in order for that conversation to have the greatest positive impact on us and everyone around us. So that would be where I would go.
That's interesting because you're not trying to change them or make them do what you want them to do, what you want them to do. It's you're actually trying to understand them, which is it actually shows a lot about who you are. So I appreciate
exactly. I want to know where you are so I can modify myself so that our relationship can be as rich and rewarding as it possibly can be. I don't want to change you. I want to make sure that we have an opportunity to grow together.
That's great. Well, thank you for sharing your knowledge and your life with us, especially also for the impactful work that you're doing at National Kidney Foundation, Elizabeth. Listeners, for more on Elizabeth's work, you could follow her on LinkedIn. We'll link in the show notes. And we hope today's conversation has sparked your curiosity. It definitely has sparked mine. And hopefully it's inspired you to explore further. Thanks for joining us. And until next time, keep on innovating.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.